Welcome to today's webinar, Curing AP Headaches from Cost Center to Strategic Asset. This is Ashley Myers, HFMA's Client Services Specialist, and I will be moderating today's session. Now it is my pleasure to welcome today's speaker. Christina Sansonetti is the Vice President of Sales at OnPhase, bringing over 15 years of leadership experience in driving finance-focused automation initiatives. Her expertise has been instrumental in helping finance teams achieve operational excellence and sustainable growth. And with that, Christina, I'll turn this presentation over to you.
Thanks, Ashley. And hi, everyone. Welcome. Thanks for joining us today. As Ashley shared, I'm Christina Sansonetti. I'm the VP of Sales at OnPhase. And like she shared, I've spent most of my career working side by side with finance leaders. And I will say I understand and know the pressure that you're under. Rising costs, tighter margins, just the constant perpetual ask to do more with less is by no means new. But it does seem as of late that the pace and the stakes feel really higher more than ever. So at OnPhase, we help organizations modernize and monetize the back office, starting with AP. But I promise you, this session is not a product pitch. Really, this is a conversation about how leading healthcare systems are truly rethinking about, what AP can do for the business. So let's move forward. AP isn't just about processing payments anymore. I think everyone on the line here will probably agree with that. It plays a really critical and direct role in protecting margins, maintaining vendor relationships, and giving leadership better visibility into cash flow. So, according to Commerce Healthcare's most recent finance trends report, 78% of healthcare finance leaders have been tasked with improving margins this year. Many of them are doing it without additional staff or a budget. I don't know about you guys, but that's a pretty tall order. And in many cases, what we find is that outdated AP processes are quietly making it harder. And maybe not so quietly, to be fair. We're talking manual work, paper routing, disconnected systems. All of these really slow you down. It drains time and it introduces incredible amount of risk, which we'll talk about later. But sometimes it doesn't clearly show on a balance sheet. So here's what today's session is all about. First and foremost, AP is actually becoming a lever. This is not just for efficiency, but for true financial strategy. The teams that we're working with today, they're not just automating to move faster, but they're actually automating to unlock better decision making, reducing cost per invoice, and even creating revenue through different things like rebates and early pay discounts. The other point that we'll talk about is that pain points in AP aren't just operational, they're actually financial. They tie directly to margin pressure. There's, of course, staff burnout and then missed opportunities. And then finally, we'll talk about how transformation doesn't need to be a full system overhaul. It often starts with just one small little shift. So like identifying your root cause of delay or exploring automation for particular workflows. So we'll talk about that as we go through a little bit further. So let's break down all of these things together, right? Where the pain points are, what they're costing you. And then in the end, really going and diving into what forward thinking finance teams are doing to turn AP into an actual strategic asset. All right. Full disclosure, our team had a little fun with the theme here, but the parallel is certainly real. Diagnosing financial health often starts the same way as clinical care, right? You start by identifying symptoms that point to a real deeper issue. And for AP, that means looking beyond those surface level delays and asking, hey, what's really going on under the hood? So we're going to run through a few common signs that we actually see across healthcare finance teams. And let's see if maybe any of them resonate with you all. So, first, when AP isn't running the way it should, I think we all can agree that it doesn't just slow things down. It really starts to impact margin. We mentioned that earlier, cash flow, and often your team's well being. It's something that a lot of people don't talk about enough. But I want you to think about whether any of these sound familiar. First, limited cash flow visibility. If leadership doesn't have real time insight into what's paid, what's pending, what's overdue, cash flow planning in the end it just becomes guesswork, right? It's like trying to treat a patient without lab results, right? Decisions are getting made without incomplete data, and that risk just starts to compound over time. Another symptom, if you will, would be just recurring approval delays, invoices sitting in inboxes, mail rooms, or just even on someone's desk, which surprisingly we hear a lot. There's no clear ownership, no escalation path, and your AP team becomes professional follow-uppers, if you will. It's frustrating, it's inefficient, and frankly, it is completely avoidable. The next thing to consider is just general high risk of fraud and errors. Manual entry, disjointed approval trails, all of these things, they open the door to mistakes. And in some cases, intentional misuse. So without built-in checks or controls, it's really easy for things to slip through. We have seen everything from duplicate payments to incorrect vendors that went unnoticed for months, if you can believe. And then finally, paper dependency. Oh, we do have one more. So the next one actually is paper dependency and staff burnout. If you are still printing, scanning, or manually routing invoices, that adds up fast. The backlog rather alone can be exhausting, right? And in really lean teams, or frankly, even in very large teams, that kind of manual load, it can lead to real significant burnout. So think about morale, think about increase in errors. Good people can get pushed to their limit. And now finally, think about those missed opportunities. Late in late payments, they're not just impacting vendors. They can actually cost your organization money. Sometimes it's in the forms of missed early payment discounts, unclaimed rebates. And if timing and payment terms aren't like truly front and center, that's margin that's left on the table. So these aren't just operational headaches, they're actually financial liabilities to consider. And the longer that they're left unaddressed, the more that they'll silently chip away at your performance. So think about those things. But first, let's take a quick pulse on the room. So, which of these AP symptoms is your organization experiencing most? Go ahead and submit your answer. We'll leave the poll open for about a minute. And if there's a symptom that you're dealing with that isn't listed here, go ahead and feel free to drop it in the chat. All right. Yeah, it's not surprising to maybe see delayed approvals near the top. That's one we definitely hear constantly from AP teams. Cash flow visibility is certainly rising. It's one of those things that, can affect more than just finance for sure. See everyone responding. Yeah, and if staff burnout is showing up for you too, just know, guys, you're not alone. The toll of manual work is real. And we'll actually dig into that, what leading teams are doing to relieve that. Oh boy, delayed approvals right at the top. So we're going to dive into these areas as we go through. So thank you for participating there. But now that we've covered the symptoms, let's go ahead and dig deeper because in healthcare, we know, look, symptoms are not just signals. To really resolve them, you have to understand what's driving them underneath. So this next phase of the webinar is all about diagnosis, identifying the root causes behind manual work, delays, and then blind spots in AP. All right. Let's start with one of the most common and sometimes the most overlooked culprits: siloed systems. Healthcare organizations, you guys rely on a lot of different platforms. You have your EMR, your ERP, sometimes procurement tools, finance systems, and more often than not, they weren't built to talk to one another. That means that the data that your AP team needs, they might be buried in spreadsheets, emails, or sometimes an entirely, separate system. For example, perhaps a PO gets created in your ERP, but your AP team has to go hunting for it when the invoice comes in. We hear that all the time. Or maybe approvals are living in someone's inbox. That's completely disconnected from your financial records. That disconnect compounds and that slows everything down. And we know the result of that is going to be extra work for your team, more room for error, and gaps in visibility that make it really hard to manage spend or, of course, forecast, cash flow. So when systems aren't speaking the same language, we know that the finance teams are left piecing together really critical information. That's not just inefficient, but it's also, it again, it compounds, it's expensive because we know that visibility drives decisions, right? And without it, your margin is left exposed. Let's move on to the next. Next up is internal controls, or rather, I would say more the absence of them. When approvals are done over email or even verbally, when roles and permissions aren't, truly clearly defined, or when there's no audit trail to speak of, I'm sorry to say, but that's when the door opens for problems. We have seen real world examples all the time: duplicate payments, unauthorized purchases. Would you believe that even payments sent to completely incorrect or even fraudulent vendors? And it's not just because people are naturally careless, but because there was no process to catch it. And in healthcare, I don't have to tell you all this, but this goes beyond inconvenience, right? You all operate in a highly regulated environment, SOX, HIPAA, internal audit standards, all of these things require traceability and proper oversight. Controls, these are protecting more than just process. They actually are protecting the organization. And it's really important that everyone leans into that notion because whether it's role based permissions, system level approvals, um, audit ready documentation, strong AP controls give leaders the confidence that, hey, nothing is slipping through the cracks. Okay. So let's move to the next one. Um, let's talk about it, right? Paper based invoicing isn't just old school. Um, it happens a lot. We still hear it today in 2025, pushing into 2026. But again, it's not just old school. It's a true anchor, right? That is slowing your team down, and it just introduces just an incredible amount of friction at every single touch point. You're printing, you're scanning, you are manually coding, you're emailing, you're filing. It is a never ending cycle of just busy work. And in healthcare, where the volume is high, your invoices, all of your invoice types are really varied, that paper can get really overwhelming very, very fast. But even worse, it's really easy for things to get lost. And I think sometimes people forget that, right? A paper invoice sitting on someone's desk doesn't show up in any system. It doesn't move forward. And it, again, going back to the theme of visibility, it doesn't give you visibility into your obligations or your cash flow. So it really comes down to, look, it's not that paper is malicious, right? It's just that it's holding your team back. So digital workflows or just digitization, it's not just about saving time, it's about control. right? Giving you controls, creating visibility, reducing rework, and freeing up staff to focus on to really focus on tasks that actually move the needle. And then finally, payment timing. Now, I would say based on, the last 12 months, certainly things are getting a lot better and people are really leaning into this as of late, but it's one of the most underutilized levers in healthcare finance. Most AP teams, they're doing their best, right? They really are doing their best to get things paid on time, but on time isn't the same as strategically. And I'm going to say that again. On time isn't the same as strategically. And I'm saying that again because, just think about your day to day. Are you just getting things done or are you just getting things done well? Right. And as that relates to payments, if payment terms aren't visible, right? If you don't know when discounts expire, if you're paying early when there's no benefit or, conversely, late and incurring fees is costing you real dollars. Healthcare orgs, you guys are working with hundreds, if not thousands of vendors. They all have different terms, they all have different incentives. But again, without visibility, without planning, in the end, it's all just opportunities getting missed. And that's why I say, hey, are we doing it on time or are we doing it strategically? Right. And that's what I mean when I say, hey, look, leading finance teams, they are moving from a reactive payment processing flow to a more intentional payment strategy. They're tapping into rebates, they're managing the cash flow, and they're turning AP into a true contributor to the organizational margin, right? All right, so let's move on to the next poll. We've walked through the root causes we've commonly see, but now let's turn it over to you guys. What do you believe is at the core of your AP challenges? And try to be, try to be honest with yourselves. Is it disconnected systems, a lack of structure, visibility gaps that maybe are keeping you from managing your payment strategy? Take a moment, submit your answer. We'll leave the poll open for a minute or so. And again, if your top challenge isn't listed here, please feel free to drop it in the chat because we'd love to hear it. We're seeing some strong responses around manual approval workflows. It's right in line with a lot of what we hear. Lack of integration certainly doesn't surprise me. It's one of those pain points that just creates that downstream issue in every part of the process. Yep, right at the top, lack of integration across systems. It truly is paper-based processes. Again, um, all of this is common. It's just, what are you going to do about it, right? So the good news is this: no matter what is showing up as your biggest obstacle, again, there's always a way to address it, right? And shift your AP strategy, if you will, from reactive to more strategic. So let's look at what a treatment plan looks like. And as you could tell, we're really leaning into that theme. So we've covered the symptoms, we've pinpointed some root causes. Again, the next logical question is, all right, how do we treat it? Right? This is where automation comes in. Um, Automation closes the gaps between systems. It eliminates manual routing. It enforces controls. I will share that, at OnPhase, we are seeing a shift where, automation isn't just removing a few clicks here and there. It's actually eliminating 100% of what we would call like transactional noise so that your team can focus on higher value work. AI and automation, they're no longer future state. They are the standard for forward thinking teams that want control, they want accuracy, they want speed. So let's walk through what that actually looks like in practice. So let's start at the top of the process. So just think about everybody, think about your day in the life. Think about your process. Usually at the top would be invoice ingestion. For most healthcare organizations, this is literally where the headache begins, right? Invoices are arriving as paper, PDFs, emails. Often someone has to print, scan, manually enter that data into the ERP. We know that that's incredibly time consuming and, error prone. And frankly, it can be exhausting. Automation changes that. It digitizes everything at the point of entry, no matter the format. So instead of your team manually, again, picture that day in the life. Instead of keying in vendor names, amounts, GLs, that data is extracted automatically. So in our case, right, we actually combine AI, we combine OCR, and then we actually have a human validation so that it is ready to go before it even reaches your AP team. So this means you're not just automating the scan, but more importantly, it's the output, which is what matters. You're delivering clean, accurate data directly into your workflow, right? It is fundamentally removing noise and sets the downstream impact up for success all the way. Next up, right, once you have that clean data that's flowing in, the next major win is automated routing and exception handling. Again, think of day in the life current state. Without automation, invoices rather, they're usually sitting in inboxes. They're going to get buried. Someone's going to be on PTO, the whole process stalls. It is one of the biggest bottlenecks we hear about all the time in healthcare and just in AP in general, frankly. With automation, what happens is invoices are routed based on preset rules. So think of things like dollar thresholds. Perhaps it's a department. Maybe it's, hey, based on a vendor or a GL, and then approvers will be notified automatically. And then, of course, if something doesn't match, it's then flagged with context and then escalated if needed, right? This is really critical because what was once creating weeks and weeks of back and forth is now within a couple of days. We actually, to that end, we actually had one healthcare client reduce their approval cycle from 12 days to 2 just by implementing structured routing with visibility. That kind of improvement not only is freeing up your team, which is important, certainly, but it's helping you avoid late payments, maybe even some early pay discounts, and then, of course, reduces the risk of any audit challenges. And it's also replacing stress, right? Let's introduce some structure there. All right. So we got your invoices, we have your routing, and then next up, now that those invoices are flowing, the next major benefit that teams receive is in how you pay. Most teams, I mentioned earlier, they're paying reactively, but let's start being more strategic about it, right? Automation gives you visibility into due dates, early pay discounts, perhaps rebate opportunities. All those things gives you the ability to be strategic. Hold payments longer when cash is tight because you can see it, right? Or conversely, pay early when it earns you a return. For some healthcare systems, these rebates alone have more than offset the cost of any type of automation, right? Of course, you can support multiple payment methods, ACH, card, check, virtual cards. But in the end, it's all about centralized control and reporting. No more hopping between systems. It is not just about paying faster, it's about paying smarter. So really truly think about that. Just think about, hey, are you just paying whenever you have time to run a batch? Or are you really, looking at things like due dates and where there are opportunities? So just something to consider, everybody. Once the process is moving efficiently at this point, this is where you really start to see the impact beyond AP, especially with your vendors and internal teams. When you are not constantly chasing invoices or fielding, Lord knows those where's my payment emails that, come through, your suppliers notice payments are on time, exceptions are handled really quickly. When that starts to happen, when you have that motion in place, that's when you start to feel like a true partner. You're not a payment chaser, right? Never mind, having a self-service portal, absolute game changer. Vendors upload documents, they can check statuses, they can update their info without, connecting or adding burden to your team. All of those things really truly matter. The other thing we see with that is it also supports internal stakeholder trust. So think of your clinical departments, think of your operations, think of purchasing. They now know they're like, hey, look, finance isn't a black hole. This is a collaborative internal partner of my department. We're responsive, right? This is where AP becomes like a driver of not only fiscal confidence, but also operational confidence because you are a critical piece of the overall organization. And then finally, this is something, so many people are talking about these days is risk reduction. So we know, the sad honest truth is manual processes, if you're still doing them, they're leaving you exposed, right? Fraud can slip through, controls aren't enforced, audit trails are incomplete. In healthcare, where let's be honest, compliance is a non-negotiable, that's a major concern. So with automation, what you get is you get role-based approvals, you get audit logs, you get duplicate payment checks, you have policy enforcement at every single step, right? This is not just an add-on. This is inherently built into a process. You're not relying on tribal knowledge or someone remembering the right approver. The system enforces it for you, and it just creates this defensible record of every action that's taken, right? So when you're thinking about your world where HIPAA, SOX, internal audits, like this is all a true fundamental reality, this kind of control, is not just a nice to have, it is absolutely essential. So think about these things as you're considering your go forward path. So with that in mind, we've looked at how automation can cure some of these headaches, if you will. Think about your department. Where are you on this journey today? Would you say you're running on autopilot? Are you still building the basics? Let's look at this poll here and get an understanding of where you are at on this journey. Take a moment, select the option that best reflects where your team stands. If it's a mix or there's more nuance, certainly drop it in the chat. I'm just going to take a quick drink of my imagine, most of the room might be moderate, which would be pretty spot on with what we see across the industry. Sometimes you are dipping your toes into automation, so maybe just haven't scaled it end to end yet. Ooh, some of you are selecting high. You are clearly leading the way. We definitely have, seen some healthcare orgs really lean in and use automation strategically. This is, again, like I was saying, our top response was moderate. As I mentioned before, definitely spot on with what we see. So you're dipping your toes in, maybe it's invoice ingestion or some basic approvals, but just haven't scaled it, right? So it's definitely a good opportunity to see where you go from here. So let's move on to some real world examples. So far, we've covered symptoms, we've covered diagnosis, we've covered the treatment plan. So let's look at some real world recoveries. These are organizations that, I'll share with you that were under pressure. from certainly some inefficiencies in their AP operations. They definitely turn things around with automation. What you'll hear in a moment is not just operational relief, but true financial outcomes that help them scale and support bigger missions. So let me walk you through a first real example. I'm not sharing specific themes just for privacy sake, but this particular example, is a very large faith-based health system. They have over 100 clinics, 50 hospitals across the nation. Actually, they're nearing 8 billion in revenue annually. And like many organizations in growth mode, they are actively acquiring new facility. Um, their footprint was growing, their AP processes weren't keeping up. And this is something we hear a lot. They're actively in acquisition mode. So automation was inconsistent, right? Some facilities had it, some didn't. They were still relying really heavily on manual exception handling, and it was slowing every single thing down. Now, I will say what really pushed them to act was the pace of their M&A activity. They realized they had a lot of fragmented systems and they just couldn't support the level of control and frankly visibility that they needed across the board. What was happening was payments were delayed, approvals were backed up, and I will tell you, their finance teams, they were stuck reacting and they were starting to get overwhelmed because they were remaining the same in terms of employee count, but the growth kept on happening, and that's not sustainable. So that's where we came in. We actually rolled out our AP automation platform. We included some series of services as well across all of our entities. We standardized how invoices were captured and approved. It was all about, all right, now that we're post M&A, let's create one clear view of the entire AP function. And the results were huge. Now they're processing over 40,000 invoices a month. Moreover, with almost 90% less manual work. More importantly, for the leadership team, those higher ups, they finally had the visibility and control to support their long-term growth because that M&A wasn't going to stop. So they really needed to ensure that, hey, we need to make sure the base is secure so that we can keep doing what we have to do. And for an organization that's under pressure, that is an absolute game changer. The second, hopefully that, maybe resonates with some of you all. Happy to talk to you one-on-one about it. But again, these are all real world challenges and very, very common. We're hearing it a lot in the healthcare organization world right now. This next example comes from a little bit of a smaller organization. They're actually a regional specialty care provider. Um, like the other, even though smaller, they were still a multi-facility system. They served patients across 5 counties. They manage about 120 million annually. But, we mentioned this earlier, like many organizations, they're just fundamentally buried in paper. They had a referral process, completely manual. It actually took them 18 staff members just to keep up with that. And even then, like with those 18 staff members, they were actually capped at 50 referrals a day, which is not a lot. Delays were common. There was quite an administrative burden that was starting to impact the team. And in the end, they just knew, like, look, we cannot keep scaling our care delivery if you kept scaling headcount at the same rate. So what we did is we implemented our smart capture, we implemented our workflow automation, a couple of other tools, and they basically, digitized their intake. They automated their routing. Moreover, they centralized their access to patient information, which was absolutely critical. And now they are processing over 200 referrals a day with only 9 staff members. That is a 4 times throughput with half the team. And they're actually even projecting a 40% profit increase because of it. So um, think about that as you think about your processes, like, hey, where are there opportunities for us to unlock some additional savings through automation, whether it be scaling without adding headcount or even reduction, because usually there is, and especially for organizations dealing with really significant paper heavy workflows, sometimes it's like start with one process. In this particular case, it was referrals. But, even something as small as that can really unlock really true operational and financial return. All right. So we walk through challenges, we explore treatment options, we've seen some real world examples, but the next, natural question is going to be, all right, cool. Well, what comes next? So that's what this next section is all about. Whether you're just starting to explore AP automation, which it sounds like many of you are, you know, um, you have a moderate approach here. Um, there is always a clear path forward. So we'll keep this simple. We'll keep it practical. Think of it like your discharge summary. So we'll outline what to look into, who to bring into the conversation, and things of that nature. But time for your last poll question. All right. We talked about opportunities, but let's be real. All right. Even when the benefits are clear, the path to automation is usually not very easy, right? And that's just what it is. So take a moment to weigh in here. What's been your biggest roadblock, right? Is it budget constraints? These are real world challenges. Is it a lack of resources? Resistance to change? That is something we talk about all the time in turn, with our clients and our prospective customers. Technology is usually the easy part. Is it change management? So go ahead, select what feels most true for your organization. And of course, if nothing seems listed here that aligns with you, drop it in the chat. Curious to see where the group is feeling the most pressure. Budget constraints was number one. And that is a great example of real life examples. Um, and I heard or excuse me, and I see in the chat, especially when you are a small organization and maybe have very limited amount of staff members, what is a good way to approach? So those are the things that we can certainly talk about, because it is true, automation is sometimes there are areas of the process where it is about, hey, maybe there are ways we can optimize the time as well for, even with smaller teams. So we'll talk about that as we go through as well. So let's talk about what comes next, and how you can really turn today's insights into real change. It's an organization. Guys, I think step one is really clear. Just identify your pain points. But what I always encourage folks to do when it comes to this is dive deeper, right? Not just we're slow or we're manual. Really dig in and be honest with yourself and your teams, right? Are invoices sitting in someone's inbox for 2 weeks, right? Um, are you triple paying utilities across different facilities? Do vendors keep calling for payment status because there's no visibility? That is the kind of, true specific pain points that you really want to surface so that you can then move into the next step. So think about that. What does a win look like? Right? So once you've identified some true, deep pain points, what does that win look like? Is it reducing invoice processing time from maybe 21 days to 5? What would the impact be? Is it cutting manual touches by 80%? Or, maybe it's eliminating late fees or capturing more early payment discounts. These metrics can become your compass throughout the project. Okay. Step three would certainly be exploring proven solutions. Um, look for platforms, and obviously I have to throw out OnPhase because shameless plug, but I promise it wouldn't be a pitch. But even if it's not for AP, right? Just look for platforms that have worked in healthcare. It's really important, because I don't have to explain it to you all, but there are complexities to how y'all operate, right? Can they handle PO and non-PO invoices? Can it ingest invoices from a lockbox? Can it match against our ERP? Um, will it support the scale of our volume across 40 facilities? There are a lot of programs out there that can't do that. So you got to ensure that whatever solution that you're talking to, that they check those boxes, because those are the things that are going to save your cycles and your headaches. The next one, guys, this seems really simple, but you'd be surprised how often this comes into the game too late. Obviously, if you're in finance, loop in your AP leader, your IT lead from the start. It's always good to incorporate IT from the start. Uh, One Health system, I just was thinking about it. One Health system we work with, we brought in procurement too late in the process, and we actually had to delay their services and product go live date by 90 days. So those little things, like that lack of alignment, can really make or break your timeline. And when you think about defining your success metrics and when you want to see success by, it can be impacted by other departments in the organization. So think about, all right, who are the other stakeholders in the organization? More often than not, it's going to be IT and procurement. How and when do we need to get them involved so that I can see success based on the timeline that's going to prove the most valuable outcome? And then finally, bring in trusted advisors. Guys, you don't need to know all the answers, right? Find a partner who's implemented this in complex healthcare environments. Um, we've got shared services, tight margins, regulatory constraints. These are all things where you need someone who can guide you on these type of integrations. Change management, I mentioned that earlier. Usually technology is the easy, and I say easy loosely, but change management is usually the biggest part, right? Um, Structuring your rebates for payments. Sometimes that outside perspective can be the difference between just going live, which is good, or can actually transform the way that you operate. Okay. So if today's conversation, sparked ideas or internal conversations, this guide is a great next step. It walks, hopefully you guys, I can't see you, but hopefully you are popping out your phone and, um, getting your, gosh, I can't even speak anymore because I've been speaking so long, but getting that QR code down. This particular guide walks through how healthcare orgs like you are thinking about, true compliance ready AP automation. So again, it's not just from a HIPAA lens, but also in terms of reducing financial risk, improving auditability, and just make sure that you're evaluating vendors with some foundation here. So this is definitely a good, helpful resource to share with your teams. It just breaks things down in a really well, plain language, gives you a modern framework for approaching automation. So again, scan the QR code, access the guide. It's short, it's practical, and it'll help keep the momentum going after the session. All right. So we're going to close out here with a couple of quick tidbits here. We've covered a lot of ground. So let's just pause, tie it all together before we jump into some Q&A. So first, we reframed AP as more than just a transactional back office function. And, there's so many pieces and nuggets that I hope you took away. But I'd be lying if I said that I really hope this is the one that you took away. Because AP, it is more than just paying bills, right? It can and should be a strategic lever in your organization, one that truly influences the organization's cash flow, financial clarity, and just ability to scale efficiently. And when that is neglected, it shows up in the numbers. So I hope you take that away. Second, we looked at roadblocks, that are common across healthcare organizations. Things like manual processes, disjointed systems, limited visibility. We know that these things are not just creating delays. again, it's introducing risk, compliance. And again, it's just going to erode financial performance over time. And then finally, we explored how, again, AP is not just a fix, it's a long term strategy. And when it's done right, it can create real clarity and can create real controls and true accountability, getting faster approvals, better data, better cash forecasting. And I know everyone would love this, just fewer fire drills at month end. So again, shameless plug with OnPhase, you're not just automating invoices. We are really working with our customers to redesign how finance supports the business so that, you're not just a reactive cost center, but it's a proactive, a proactive driver of value. We don't want you spending all your time chasing paperwork. We want you to focus on what really matters, which is what is, delivering care. Okay. So let's dive into some questions.
Awesome. Thank you so much, Christina, for that really informative presentation. I would like to invite everyone listening to enter your questions in the Q&A box located on your computer screens. First, Christina, can we circle back to the comment about the smaller organizations and how they can find, buy-in for technology with a small budget or no budget at all against competing priorities in the
Yeah.
business?
Yeah, it's I say it's funny, but what I mean by that is it's actually very common. So even I'll speak from the perspective of OnPhase. For example, we work with very large organizations, but we also work with organizations that have 2 or 3 staff members. And what we encourage is starting small. Sometimes there can be just 1 or 2 small processes. I think back to, the organization where they just did the referral processes and they were able to, have a throughput of 4 times just by digitizing a form. Sometimes it's not about just, creating a whole complex AP approval process and invoice ingestion, which is ideal state. But sometimes it can just be, hey, what's one thing that can maximize our throughput? Sometimes it's just, hey, document management. Maybe it's just digitizing a form. So I would encourage you, what is that one thing? I hope that helps, Ashley.
I think so. Thank you. Do you have any specific strategies that you use to address like change management during implementation of your solution?
Oh, yes. So I'm going to have maybe after we can share some resources because we've actually done a webinar on this specifically. Um, Change management, we can talk about that for hours and minutes. So maybe, Ashley, for a suggestion for the next webinar. But it starts with, I would say the most critical piece is, yeah, I don't know if y'all have ever heard of this, but the meeting before the meeting. Basically, what all that is, hey, start talking and aligning stakeholders before you start executing on this project. You need to start, talking to your frontline folks first. Hey, what's weighing you down? Start with the frontline folks, understanding what their day-to-day looks like. Start getting their input. Hey, what would make your day a lot easier? Um, Before you start saying, well, hey, we're going to be doing this great project. It's just really all about getting input from the frontline users and other stakeholders before you execute on a project so that they can feel as part of the overall solution. That would be I would say the number one thing that has to be done. There are other things, certainly, but if I were to say, all right, what is going to be the number one thing that's going to have the most maximum return, it would be that.
Great advice. How do you measure return on investment?
That is actually a great question. So it's going to be dependent on the organization. So I'm going to go back to, the first question or one of the earlier questions that we posed in this particular webinar, which is, what is your success criteria? So the success criteria would be, it may be, hey, I want to reduce my invoice approval time from X to Y. Or in some cases, it may be, hey, I want to decrease our FTEs by X%, whatever it may be. Dependent on what your desired success criteria is, what's going to drive the ROI. Typically, the ROI is going to be derived from two key critical things. The first one being time saved, because once you start calculating, like, and we literally will do this with our prospects and our customers, is we actually calculate the time and align it with the fully loaded cost of your employees, because then we can quantify how much you are actually spending on particular tasks. You would be surprised, well, probably not surprised but shocked when you see how much money is actually being spent on a day-to-day basis on some really manual tasks. So that is one, time savings, and then how it equates to, what you're paying employees. And then the second one is just probably the easiest, like most clear cut hard cost analysis, which is, FTE reduction.
Thank you, Christina. There's a question about the biggest challenges that teams face when transitioning from manual AP processes to automation, and how can we mitigate these risks?
I think well, first of all, that's a very good question. It aligns with an earlier one, which is fear of change. Um, we've always done it this way type of thinking. As I was mentioning earlier, we mitigate that just by bringing users in early. Sometimes it's piloting with a few vendors and just building confidence as you expand. Again, it's also really critical to automate thoughtfully. Um, don't just mirror a broken process in digital form. And what I mean by that is sometimes, we'll have conversations like, well, hey, this is how we do it. This is our process. And then our natural next question is, okay, well, is that the best way? So don't just take your existing process and make it digital. Find out where there are opportunities to improve.
Great information. Do you have any closing remarks?
No, I don't know if I have any. I would just say thank you so much, everyone, for joining today's session. I know your time is valuable, and I hope that you're walking away with some new ways to think about your AP strategy and just how automation can be a lever for better financial control. So, if you do have questions that we didn't get to, or you just want to dig deeper, just scan the QR code here on the screen, visit onphase.com. We're happy to set up time to walk through your specific use case. Again, whether you're just starting or already down the path. So appreciate your time, your engagement, and all the work that you guys are doing to move healthcare forward.
Thank you, Christina. And with that, we have reached the conclusion of today's webinar. I would like to thank Christina for presenting and OnPhase for sponsoring. We hope that you found this presentation informative. Thank you for your participation. Have a great day.